I'm Dr. Sun. I'm the pediatric neurosurgeon here at Children's Hospital in Oakland. Well, we're a very busy center, so this is, exactly what we needed, so to say. Sometimes, we would do a scan post-operatively, and, on rare occasion we find that, something is not ideal, whereas if we had the CereTom, we could have detected that, right in the OR and perhaps had the opportunity to, adjust things before the patient's awakened and taken out of the operating room. This way we can bring them to the operating room, sedate them, put them to sleep, get the scan that I need to plan certain things, and then going ahead and proceeding with the operation. The other day we did a case whereby I wanted to see if the ventricular system was communicating, so right after the patient's put to sleep, we put a little dye in. I can see that, all the patient needed was one catheter, that all the spaces are communicating. I think they're very comparable. It certainly shows me what I need to see.
Hi, I'm Ron Cohen, Director of Diagnostic Imaging at Children's Hospital, Oakland. Okay. When we evaluated the scanner, we were surprised at how good the images were. The head CT scans were equivalent to a more expensive and larger scanner, and it is easier to perform this examination in selected patients in the ICU or in the operating room.
Outside the operating room, of course, is the ICU. Some of these children are critically ill, so instead of having to transport them, they can be scanned in the ICU, which is very, very nice.
My name is Claudette Arguello, and I work in the ICU here at Children's. Well, basically, we had to gather different parts of our team, our respiratory therapist, physician, the nurse. So we have to maintain the airway as you're traveling, and you have to maintain the patient's stability and, all the drugs that are infusing and things like that. So just the ride itself could cause the patient to go into distress. So it was a lot of coordination, a lot of team effort in getting the patient down there. So it took some time. Overall, I would say from beginning to end, maybe 45 minutes. Well, you're probably cutting out about half an hour of travel time and setup and takedown time because you're doing it all at the bedside. So, and the patient's safety and stability is most important. So.
Well, it affects the staffing because it changes the responsibilities. I think that it requires more radiology staff, but maybe requires less nursing or respiratory therapy staff. So you have to plan appropriately so that the sick child in the ICU might require less transport, and so that helps your staffing, but it requires more radiology staffing to move and manipulate and operate the machine.
My name is Jake, X-ray tech at Children's Hospital, Oakland, X-ray and CT. Once you set up, it's a very easy machine to use, to operate. Very user-friendly. As patients go, a lot easier for them. They don't got to come down here. A lot easier for the nurses, for all the transport teams, for the radiologists, for the doctors ordering the exams. A lot easier for them. Mainly the patients, though.
Doses that are used for head CT are equivalent to that used in a larger, more expensive CT scanner, and we're working with the company to make sure that we establish pediatric CT protocols that are appropriate for children. Wow. I think in summary, the CereTom has been a good addition to our hospital. It allows us to have a backup head CT scanner for trauma. It allows us to take care of selected patients in the ICU and in selected neurosurgery patients who need it at the time of surgery. And we've been leaders in pediatric CT for many years and have always been interested in doing the appropriate exams and establishing appropriate techniques for pediatrics, and we're happy to help the company provide those techniques for children, since we think it will be used in other hospitals.
This machine is cost effective in that it really helps with patient care. And I think it's going to be a standard in the future amongst hospitals that treat acute patients and do neurosurgery. you.